Today we are going to discuss about pulmonary embolism. So, pulmonary, it is related to the lungs, and embolism, it is a air or like a air type form of a clot that will be which is movable. Thrombus is nothing but it is a clot which cannot be movable. It can be obstructed and it causes a damage to the supply, blood supply, and causes a like continuous disruption of blood supply will be occur to the patient, is nothing but pulmonary embolism. If we take example, this is a artery. We have seen in a definition, it is a blockage of pulmonary arteries. So, artery, it is a artery. We are taking example like any plaque formation. Plaque is nothing but a fat. Okay. So, here the plaque formation or a fat formation which will be there in a arteries, or if a thrombus formation, thrombus which can interrupt a blood supply, or if we take emboli, so the air type of a blood clot which will be formed here where there is no supply. The thrombus will be obstructed there. The embolus can be movable to one part to the another part. So, that time there will be a stoppage of blood circulation and causes a stoppage of a functioning of a pulmonary system. So, that is what it is, a blockage of pulmonary arteries by thrombus, fat or emboli, and tumor tissue. Because of tumors also there is a chance of occurrence of this disease condition. So, moving to our next is etiology and risk factors. So, what can be a etiology here? So, mainly the etiology can be a diabetes mellitus and venostasis, homeostasis. So, first one is in your etiology. So, we have a diabetes mellitus. So, diabetes mellitus may be a cause, like it is also a risk factor to the patient who are having this disease condition. Then we have mainly homeostasis. Then using of certain anticoagulants. So, using of certain anticoagulants, and we have COPD. So, this COPD is chronic obstructive pulmonary disease. So, because of this also there is a chance of occurrence of this pulmonary embolism. Moving to our risk factors, as the risk factors may be like obesity. So, obesity may be, the triglycerides may be higher, so that the patient may chance of getting this pulmonary embolism. Then you have a family history. Then we have then is the genetic factor. Then a smoking and alcoholism. So, these are the risk factors which will be included in a pulmonary embolism. So, these are the main causes and risk factors which will be causing a embolism in the patient and it causes a respiratory disease. And moving to our next is pathophysiology. So, pathophysiology, so the disease process, how the process is, the embolism is occurring, and this embolism, how it is getting caused to the patient, you will be observing here. So, due to any etiological factors. So, due to any etiological factors, so we have taken example like any emboli. So, here, so when the embolus is entering into the artery, so when it is getting entering, so what happens here? So, there is a disruption of blood supply. So, when there is a disruption of blood supply, so when there is a disruption of blood supply, there is a cause of obstruction of blood supply. When there is a obstruction, there is decreased blood supply. So, when there is a decreased blood supply, automatically there will be a necrosis. Necrosis of particular area, or like a artery or the particular tissue will get damaged, and there is no continuous supply will be there. There the patient will have a like a congestion of a heart, like a shortness of a breath, or the patient will have dyspnea, or the patient feel like very dizzy because of this pulmonary embolism. This is what pathophysiology of pulmonary embolism. Moving to our next is clinical manifestations. So clinical manifestations normally when the embolism occur. So if it is like the patient may have a fever, or the patient may have a symptoms like dizziness, weakness over the body. So we can see mainly the chest pain will be there. So signs and symptoms like clinical manifestations, like first one is chest pain, because the patient may have like congestion of congestion of the respiratory tract, so that the patient feel like very dyspneated, that time the patient may have a chest pain. And second one is like dyspnea. So dyspnea is nothing but a shortness of breath, and the patient will not take oxygen properly, and the patient feel very difficulty in breathing. So then we have a fever, tachycardia, tachyapnea. So tachycardia will be present, tachyapnea will be present. Then the patient may have fever. Then the patient will have symptoms like nauseated and vomiting. And chest congestion will be there. Then the crackle like sound will be present in a respiratory tract. When you auscultate the patient lung, then we can see the patient is having a crackle like sound in the lung area, like through the stethoscope if we are observing like breathing, inhaling and exhaling, so that you will be observing there is a crackle sound or wheezing sound in the patient's lung. So these are some of us clinical manifestations which can be seen under a pulmonary embolism. Moving to our diagnostic findings. So mainly diagnostic findings can be done like history collection and physical examination is normal for all the disease condition. As in a history collection, so as I told, the patient is having any previous history, like a past history with any disorders like asthma, or the patient is having any heart diseases like myocardial infarction, or you will be observing any other disorders which will be associated with the lung, that history can be collected. Then physical examination. In a physical examination, mainly you will do head to toe examination. So in a head to toe examination, mainly you will concentrate on systemic examination on a respiratory tract infection. So you will be observing for in respiratory system. So in a respiratory system, mainly you will observe for like all the symptoms like chest pain, the patient is having dizziness, difficulty in breathing, tachyapnea, how many episodes the patient is having a breathlessness, everything can be observed in a physical examination. There we can see like wheezing sound and the crackle sound, or the respiratory rate, it is higher or not, like it is normal or higher, you will be observing in a physical examination. Then we will see for CT scan. So you will be observing through the CT scan any blockage is present, in where the blockage is exactly present through the CT scan we can observe, that is computerized tomography. Then MRI also is done. MRI scan is nothing but magnetic resonance imaging, so that you can identify transversely or longitudinally where the block actually it is situated. Then we will see for like biopsy, if it is like tumor and all, you will be sent for any biopsy in order to identify the tumor is present in a patient body. Then you will identify for other diagnostic findings, like the patient will have mainly in a respiratory system, you can see the X-ray, chest X-ray can be done. So because the patient is feeling like chest congestion and all, you will be observing for chest X-ray. So these all diagnostic findings commonly done in a patient who are suffering with the pulmonary embolism. And moving to our next is management. So management. So in a management, normally we will see medical management, surgical management and nursing management. So in a medical, again you have pharmacological and non-pharmacological. So again in a surgical, what all surgeries like embolectomy, embolectomy can be done, that can be seen in surgical history. So now in a pharmacological, so pharmacological it indicates drugs. So like which type of drugs we are indicating here, we will be observing. First one is anticoagulants. So anticoagulants can be given to patient because as the patient is having like blockage, so that you can give warfarin or heparin. So as the doctor's prescription and the patient condition, you will be giving of anticoagulants. Next is thrombolytic agents. Mainly you will give thrombolytic agents. So thrombolytic agents like streptocase and amicase and streptocase. So these two drugs mainly you will give for the patient who are suffering with this pulmonary embolism. So anticoagulants and thrombolytic agents and fibrinolytic therapy also can be given in order to have a normal circulation to the patient. Then is non-pharmacological management. Here mainly you will concentrate on deep breathing exercises, because the patient is having like chest congestion or the patient is having chest pain, so that you will be administering like deep breathing exercise and the relaxation therapies to the patient in order to have a normal circulation of lung. So we are going for the surgical management. So embolectomy is nothing but when the embolus is formed here, so embolus is moving from one place to the another. So where you will be identifying where the actual embolus is formed, so that that embolus can be removed through the catheter. So you will insert a catheter, that catheter can be placed into the arteries, so that it can be removed easily from the particular arteries or the veins where it is getting obstructed. So that is nothing but embolectomy, is nothing but removal or removing of the particular emboli in the arteries or the veins. So moving to our next is nursing management. So nursing management is nothing but, so we will be assessing, then we will be diagnosing, and you will be doing intervention. So first one is like assessment. So in a nursing management you have assessment. So this assessment mainly you will assess for the patient level of consciousness. The level of consciousness is good or not, patient mainly you will observe. Then you will observe for level of consciousness, then you will observe for like the patient is having how many episodes of dyspnea, how much the patient is taking of oxygen, as this can be maintained, like oxygen therapy can be given here. So how many liters of oxygen therapy is given to the patient, mainly you will be observing. If any CPR, if it is needed, when the patient is having like arrest, cardiac arrest and all, you will be giving CPR. So you must be very ready with the CPR, like cardiopulmonary resuscitation can be done, or the patient is having any other symptoms. According to the symptoms, we will be treating of the patient by doing the assessment. Like normally like blood pressure and the vital signs can be monitored, and the nutritional status can be monitored, and any lung pleural effusion associated with pleural effusion or any other like COPD we are seeing, like causes and all. So in that cases and all, you will be assessed according to the patient condition. So moving to a diagnosis. So in a diagnosis, mainly Nanda diagnosis you will see. So first of all we will see ineffective tissue perfusion. Ineffective tissue perfusion related to dyspnea. So first of all we have to write regarding of a disease condition, because the patient is suffering with the major disease condition. We have to observe and we have to form a nursing diagnosis. Then we have acute pain related to, now the patient is having a acute chest pain. So the pain, acute pain related to, so acute pain related, why the patient is getting pain. So here maybe due to a disease condition, like the patient is having emboli, so that the patient is getting a chance of occurrence of this acute pain. So moving to our next is like risk for infection related to poor personal hygiene. So poor, if the patient is having poor personal hygiene and the surroundings are not clean and the surroundings are not proper, so that there is a chance of infection to the patient. So here next is like, so we have covered a management also now. Now the complications are, so mainly the complications you can see for the patient is shock. So shock is nothing but when like a hypovolemic shock or the cardiogenic shock can be occur to the patient. So complications like mainly shock can be seen in a patient. This is a major complication. The patient may have a severe like a hypovolemic shock or a cardiogenic shock to the patient. Then we have COPD. COPD also one of a major complication that can be seen under a patient. These are the complications which can be seen under pulmonary embolism. So, the pulmonary embolism is nothing but the blockage of a artery where there is no continuous supply to the particular organ or like a lung is called a pulmonary embolism. Thank you.